Good morning. I'm Dr. Sarah LaHue, a neurologist coming from UCSF. Thank you for the opportunity to speak about the association between COVID-19 severity and delirium in hospitalized adults with confirmed SARS-CoV-2 infection. I have no financial disclosures. The severity and inflammatory/vascular pathophysiology of SARS-CoV-2 suggests that this virus could be particularly deliriogenic, with important implications for the long-term impact of the pandemic. Despite recognition of psychological and neurological complications associated with COVID-19, the impact of COVID-19 on delirium frequency is largely limited to ICU populations. Further, the relationship between COVID-19 severity and delirium is poorly understood. We sought to measure the association between COVID-19 severity and delirium in patients cared for in the ICU, as well as on transitional units and acute care floors. We also investigated the association between delirium and the use of restraints and presence of safety attendants, as well as their discharge home. For our methods, we included all patients with confirmed COVID-19 hospitalized for at least 48 hours from February 1st through July 15th, 2020. COVID-19 severity was based on WHO criteria quartiles within 24 hours of admission. All patients were screened for delirium twice daily as part of hospital protocols. We were lucky in San Francisco because while we cared for many patients with COVID-19, our hospital protocols never became overwhelmed. Patients in the ICU were screened by nurses with the CAM ICU. Nurses screen non-ICU patients with the Nursing Delirium Screening Scale, or NUDESC. Multivariable logistic regression models assess the association between initial COVID-19 severity, age, and delirium, as well as the association between delirium and clinical outcomes, adjusting for clinical characteristics. There were 99 adults hospitalized for COVID-19 during this period. 43 of these were delirious. Of those who were at least 65 years old, 19, or 63%, were delirious, compared with 24, or 35%, of patients who were less than 65 years old. Patients with the highest level of COVID-19 severity within 24 hours of admission had 31 times the odds of being delirious compared to those with the lowest level of COVID-19 severity. Advanced age only slightly increased the odds of delirium in this cohort. COVID-19 positive patients with delirium had increased odds of restraint use during hospitalization compared with patients without delirium, and COVID-19 positive patients with delirium had decreased odds of being discharged home compared with patients without delirium. Delirium was not associated with safety attendant use. To conclude, delirium is common in hospitalized adults with COVID-19, especially those with severe disease on hospital admission. Delirium is common even in younger patients with COVID-19. Delirious patients with COVID-19 are more likely to require restraints during hospitalization and are less likely to be discharged home compared to those without delirium. Individuals with COVID-19 represent an important population to target for delirium screening and management.